tonight. It's Jill Slaven again, the registered nurse, certified diabetic educator that has been with you probably every other month, I guess, here at Valley Professionals. We've been doing these virtual diabetic meetings. And here we are at the end of the year. So this is the last one for 2021. I just want to remind everybody as we get started, to be sure to click the mute button so that we can't hear the background noise where you're at. And if you have questions or comments, go ahead and just send us a message in the chat option and we'll get to them. If not before, we'll get to them at the end of the presentation. And that way everybody can get their questions answered. And also if you go ahead and mute now, then we won't hear things that are going on in the background at your place. So go ahead and do that now before we get started. And I just want to give everybody a chance to be able to jump on at lunchtime here. I know everybody's probably trying to view this sometimes during their lunch and get a chance to get something to eat and then jump on before we get started. So if you have any questions, comments now, go ahead and send them. If you are not a patient at Valley Professionals, but want more information on Valley Professionals or on me as a certified diabetic educator and what I have to offer our patients here at Valley Professionals, just send me a question or a comment there in the chat and we'll get back with you on that also. All right, so let's go ahead and get started. So you all know it's almost a new year, and we've talked a lot about self-management, and doctors use those words, and I use those words, self-management, a lot. But I thought, it's about time we actually kind of delve a little deeper into what does self-management mean. And specifically, of course, we're going to focus on self-management of someone who has diabetes and what they have to do to self-manage blood sugar. So just a little bit of a last year, 2021, if you're like me, probably every year, maybe it goes through your mind, you'd like to maybe, make a New Year's resolution. And it seems like even though I endeavor to make a New Year's resolution, it never lasts. I mean, sometimes it lasts a few weeks, maybe to the end of February if I'm lucky. But at the beginning of 2021, this fleeting thought, went through my mind is, okay, what's my New Year's resolution going to be? And the first came to me quickly right after that is you never keep them. So why even make one? And then I started thinking about what I try to work with my patients that I meet with. And one of the things that we're taught as diabetic educators is that when you set a goal, you should make it, a simple goal. It doesn't have to be really complex, and it needs to be something that's attainable. And so that day I was walking into work without my coat on, and it was January, of course. And I thought, why don't I just make a goal of not wearing a winter coat? So that's what that picture of the winter coat is. So I made that my goal. And even though it might seem silly and very simple, I thought, I've not been able to attain anything else, just make it something very basic. Research also shows is that when you make a goal and you're able to you keep it, it actually can spur you on to create or to make other goals and make those goals maybe even a little bit more difficult. And the more you attain them, the more you're willing to make new goals and just kind of keep going to where it becomes part of your life and it doesn't seem so overwhelming. So in 2021, I made this New Year's resolution to not wear a winter coat for the whole year. And it must have been a pretty mild day in January for me to even think of that. I usually remote start my car from inside the house, and I only walk about 15 steps to the inside of the building where I work. I mean, sometimes a little further depending on what building I'm at. I thought, how hard could it be? So being frustrated with my other New Year's resolutions that didn't pan out, I chose this goal and thought that there was a pretty good chance I could keep this resolution. Now, along the way, people made fun of me. They doubted me. They called me crazy. And sometimes they even said that I wasn't keeping my resolution because I had a sweatshirt on, but I reminded them that my goal was specific. I had set a winter coat. So that's another thing when we set goals, and as we get to the end of it, it needs to be specific when you set a goal. And so you can, at this time, it helped me kind of refute those people who were making fun of me or telling me I wasn't meeting my goal. You're going to run into those people also along the way as you set healthy goals for yourself. So just kind of keep in mind my simple, silly winter coat New Year's resolution as we go through talking about self-management of diabetes and then also setting some goals throughout this year. Again, I said this earlier, they say sometimes that if you set a goal and you meet that goal, it makes it easier to then go on and make another goal and keep it. And this behavior just becomes part of your life. And then keeping those goals and setting more difficult goals doesn't seem so overwhelming. The idea is that once you set this goal, meet it, it becomes easier. And you're not afraid to go on and work harder on those other goals that you thought you would never even want to even set or attain. So it's a new year, and I'm wondering, are you thinking of a New Year's resolution like I did? And I'm starting to think of what's my New Year's resolution. And to tell you the truth, I'm actually thinking, okay, well, last year I was able to meet that goal. I was able to so far. It's not the end of the year yet. I still have a few days, and hopefully the weather is going to stay mild. So I won't have to break my goal and go ahead and get that winter coat out. But, I am thinking, I was able to keep that goal. It wasn't that overwhelming. So what do I want my next goal to be? And actually, I do feel like a little bit more confidence in setting that goal. So I'm wondering, are you ready to make some changes for the new year? Have you, though, also been discouraged in the past with not being able to keep those past New Year's resolutions? So as we work through the presentation, keep in mind that very simple goal of just not wearing a winter coat as you start thinking about goals that you'd like to set. Because if you think about it, if you really think about it, rarely are we unmotivated to live a long and healthy life. When I think about this, I think, why is it so hard to then set those healthy goals and stick to them? Why is it so hard to continue to self-manage our food choices, our exercise, our blood sugar, and all those things that it takes to really have well-controlled blood sugar? Because if we really are, none of us, I can't think of anybody who's unmotivated to live a long and healthy life. I think sometimes, though, it can be easier to meet these goals if we already have a path to follow. If we already have a toolbox filled with those needed tools that we need. And so last year, every year, or every time we met, which was I think about every 2 to 3 months, we would discuss the 7 self-care behaviors from the AADE. We talked about healthy eating. We didn't focus a lot on healthy coping, but that came into some of them. You can't help, they're all these 7 self-care behaviors are intertwined. So you couldn't help but actually hit on them a little bit each time. We talked about being active at times. We covered monitoring a lot, especially when we talked about the continuous glucose monitors. That was the very first presentation that I did on CGMs, or continuous glucose monitors. Throughout, again, intertwined, taking medication is one of the 7 self-care behaviors for managing blood sugar. Problem solving, it came in here and there, but again, we didn't specify it out. We're going to talk more about it today. And then reducing risk, another thing we did not specifically cover, but we're going to talk today more general about what each one of these looks like or could look like for you when you're working on managing blood sugar. And then this next year, as we have these virtual diabetic meetings, I'm hoping to delve even deeper into each one of them. But I want to give you a general overview of what are these self-care behaviors. And again, there's 7, but that doesn't mean you have to be doing all 7 at once. If you can, that's great. But really, again, taking that first step is the place where we want to start. They all intertwine. And so as we go through here, we're going to specify out exactly what they look like and maybe some examples of where you might want to, you could get started. So just in general, diabetes self-management, again, there's those words we use a lot. How do you self-manage diabetes? Self-management in general is our activities and behaviors that an individual undertakes to control their condition. It doesn't have to be about diabetes. It could be about, cholesterol. It could be that you're wanting to self-manage your cholesterol. You could self-manage heart disease. So any chronic condition, but in this case, we're talking and we're focusing in on diabetes. So I'm going to encourage, okay, evidently I did this little thing here, I forgot. So again, there are those 7 self-care behaviors that we just talked about on the last slide. I'm going to encourage you just to take small steps to make those big changes in 2022. And the first, I don't want to say the first, but one of the self-care behaviors is healthy eating. Again, we've talked about this. It's probably something you know a lot about. I just put a few general things there that you can think of when you think of healthy eating: making healthier food choices, reducing portion size, meal plan. Again, let's just choose one of these things. You don't have to do all of them at once. Let's just choose one and see what we can come up with. Let's just choose thinking about the size of your plate. I've used this slide before. I think I may have used it in a previous presentation with this virtual diabetic group. But it's such a great reminder that we have changed so much over the years. In the 1960s, our dinner plates were 8.5 inches, maybe 9 inches, and it held about 800 calories. In the 1980s, the plates grew to 10 inches, and they held about 1,000 calories. In 2000, again, they grew 11 inches, and they held about 1,600 calories. And then in 2009, those dinner plates have gotten to be 12 inches. I've even seen 16 inches or 14 inches, and they hold about, this one that's 12 inch, holds about 1,900 calories. And I think the thing to think about is the larger the plate, sometimes the larger the portion size. Again, I use this slide a lot, and it's, they're trying to quiz you and say, hey, which one has the most food on it? When you look at it, you would think that, which plate contains the most food, you would think that you're being overwhelmed on that small plate, but actually each plate has the same amount of food. When you eat with a larger plate, at some point, whether it's by accident that you start filling that plate up and that small portion becomes larger, or I always think it's something like when I see such a small amount on a large plate, it seems like I'm being deprived. And anytime we're being deprived, it's almost like we don't like that. We find that offensive, and we do something to change it. We try to fix it so we aren't deprived, even though it's all in our mind, because if you look, the same amount is on the small plate that's on the larger plate. And it's time to really just start. One thing you could possibly do, that small step you could do, is actually start evaluating your plates and actually eating on the smaller version. Measure your plate. Even if you have to go to the store and get the paper, styrofoam, whichever plates that have the divide, like half of it divided out, and then the other half divided in, would be quarters. I think I have a slide here. Yeah, kind of like the My Healthy plate at the top there is. Do that if you have to. That could be one small goal that you want to set for yourself, that you're going to start evaluating your plates every meal, and you're going to start trying to eat healthy with just using the My Plate. And if you look at each one of the examples of the foods on those plates, I mean, those plates look pretty full, and they look actually very appetizing. So it's not like you're going to be deprived. But again, that's just one little area that you could start making some big steps in. Also, another one when it comes to healthy eating is kind of paying attention to what you're doing when you're at the grocery store. Before you even go to the grocery store, map out what your menu is going to be. Don't shop on an empty stomach. They've said this forever. I've heard this forever, and it actually works. It's not an old wives' tale. When we're hungry, we tend to crave more calories, more dense food for that survival mechanism. We start wanting to eat more. We start just putting it into the cart because we're hungry at that time. Keep in mind that many healthful foods can be found along the perimeter of the store. That's where you find your fresh produce, your dairy products, your fresh poultry, fish, and lean meats. Spend most of your time, I'm going to show a little picture here and then a little bit of that. Spend most of your time in that outer perimeter or in the produce section. And on the off seasons, go ahead and buy frozen fruit and vegetables. They're frozen at the peak of freshness. If you have to, then also buy canned if you have to. But if you can't afford the produce in the produce section, it can get, specifically lately, it's been getting more expensive. Try to think of other ways like frozen or canned if you have to get your fruits and vegetables in. Choose whole grains carefully. Take sugar-free with a grain of salt. What we mean by that is sometimes, even though it says sugar-free on it, can be a red flag, because some highly processed foods that may be made without sugar but may contain other carbohydrates can still raise your blood sugar. Often people look at the grams of sugar, but everyone really should be looking at the number of carbs, because all types of carbs can affect your blood sugar, and those carbs are in the total amount of the total carbs when you look at a food label. Trans fats are the healthy fats for everyone, so try to ban the trans. Anytime you see a lot of trans fats on a food label, try to avoid those foods. Those are the ones that raise your bad cholesterol. Try to choose foods that have zero trans fats. Fill your cart with healthy snacks like almonds, walnuts, maybe a protein bar periodically. Make sure that you check the label to find the protein bars that have high protein and less sugar. And then when you are at the store, again, like I said earlier, try to stay on the outside perimeter. As you look at this picture, and some of the middle looks a little blurry to me, but you can see like the person started at the front of the store, went through the produce section, stayed on the outskirts, just jumped in to the aisle to get condiments, and then to get water, and then back out to the perimeter. And if you look at think about the store you go to, the grocery store, what's in the middle? That's where the chips are, that's where the cookies are, that's where the crackers are, that's usually where the bread is. I mean, think of all those things are in the middle of the store. It's not this, all of them are unhealthy. It's that you want to jump in and get out, because the more you walk by them, there's a chance you might want to put that in your cart. If you stay on the perimeter most of the time, you're going to choose foods that are healthier, or healthier choices, at least for someone who's trying to manage blood sugar. So one of the other of the 7 self-care behaviors is being active. Let's just take one of these. Again, there's, you can exercise longer, you can exercise more often, you can follow a specific exercise plan. But let's just take one of these and delve a little deeper. Take one step. We actually started a walking group here at Rockville last year. We talk to our patients about getting active, but yet there's not a whole lot of options. And we thought it's time for us to do something. So we started a walking group. It met March through October. We started small. Our goal was just to walk one day, at least 30 minutes. But we also individualized that. We walked at a place where we went in like a circle area that a person could actually drop off early if they wanted to, if it was too much for them that day, because it got pretty hot this last summer. And so individually, some people only walked 10 minutes at a time and then built up from there. Some of us walked 30, some walked further. It was a place that allowed that, so we could still kind of keep on contact with anybody who was walking with us, but at the same time, you could individualize it. But literally, we started out one day a week with 30 minutes, but quickly, we ended up walking longer, 45, 50 minutes. And then we realized, okay, this isn't enough. We need more. So we added another day. Again, it was always an option for anybody who came. If they wanted to come those days and walk with us, or if they wanted to walk shorter amount of time, that was fine. But you could see how, as we started out small, we set a goal that was attainable. Then we added to that goal as we were able to build on that. So that's what I'm asking you to do, is take one small thing, one simple thing, and actually get started with it to make those changes for self-management of diabetes. Another self-care behavior is monitoring. I mean, some things that you can think of when you think of monitoring is following a monitoring schedule. When do you check your blood sugar? How often are you checking it? Maybe monitor more often. Monitor not just blood sugar, but monitor your whole health status by keeping track of your labs or your blood sugars to see how they change. So do it for a certain length of time. If it's your blood sugars, think about checking them maybe just for 2 weeks. And tell yourself, now if you are taking insulin or you've been told differently by your doctor, then definitely follow those guidelines. But if you are on some oral medicines and you just don't like checking your blood sugar, but we need to know what your blood sugars are doing so we can have an idea, the doctors can, to know what they need to do to adjust medication. You need to have an idea so you can know what food is doing to your blood sugar. Just tell yourself, for 2 weeks, you're going to keep better track and alternate days and times. So here's an example, like for day 1, you might check before breakfast and then before dinner on that same day. And then on the next day, check before lunch and before bedtime. And then the next day, day 3, go back to that, what day 1 was, before breakfast and before dinner, and then before lunch and before bedtime. And then alternate those throughout those 2 weeks. Bring this record with you to your next visit. This is going to help your providers know what the pattern is with your blood sugar, like what's going on and where they need to make some changes and what changes would actually be the most benefit for you. There's no reason to start a medication if that doesn't affect that area of your blood sugar, and it goes together just like that. If you're noticing that your blood sugar is high, you go to bed and you check your blood sugar and it's 100 and you wake up and it's 300, then there's a problem overnight when there's no food on board. You haven't eaten anything, I don't think, overnight. We would assume you hadn't. You need to tell us if you did eat something, because then that could be what's affecting your blood sugar. But if you've not, during times of fasting, your body's not taking care of that blood sugar. So there's something different your doctor would want to do. So keeping just a 2 week, even if you're not willing to check blood sugar more often, That's not something you enjoy doing. Those 2 weeks can really give you and your doctors a lot to talk about. And we talked about continuous glucose monitors earlier. I think it was the very first virtual diabetic meeting we had. Consider getting a continuous glucose monitor. Usually insurance pay for them. Even if you're not on insulin, they'll pay something sometimes. That's not maybe true for Medicare and Medicaid, but for commercial insurances, they will pay something. And even if not, if you can use your phone, then it's just really you're paying for the sensors. And sometimes they're just as affordable as what some of the strips are that go with your glucose meter. So if you're interested again in a continuous glucose monitor, and that's something you'd like to look into, then talk to your doctor about it at the next office visit, or go ahead and schedule an office visit to discuss it. Or if you're one of Valley Professionals patients, definitely call one of our offices and ask to talk to me, Jill Slaven, and we can meet and talk more about this, and we can see if your doctor will be willing to prescribe and then what we need to do to get that sent into the pharmacy. It's an option. It's a way of just monitoring what's going on and with blood sugar consistently. And it is such a great experiment to say, you know what, I'm going to see what this food does to my body, how my body reacts when I eat mashed potatoes and gravy, when I eat just plain, turkey with no mashed potatoes and gravy. And you can see what happens to your blood sugar, and it's an eye opener for you. So along with that, that's a personal CGM I was talking about, but our offices are getting ready to start a new thing in January where we actually have office continuous glucose monitors or office CGMs. If that's something that you think would help you with managing blood sugar, that you'll need to make an appointment with your doctor to talk about that, because they have to order it. But we're going to have those starting sometime in the middle of January. That's an option. And you would wear a sensor for 2 weeks, and you would come back. We would download that sensor, and you would see the doctor to go over all the data that we would get from that sensor that's continually checking your blood sugar. I believe the office CGM is every 5 minutes. It's taking a reading of your blood sugar. So if that's something you're interested in, again, that's one of those small steps you could take. Make an appointment to talk to your doctor here at Valley Professional about the office CGM. Again, give us till about the middle of January to get this started. But that would be an eye opener for you for the rest of for this year, to really see what your blood sugar does every 5 minutes, and from what you've eaten, from the exercise that you've done, what benefits your blood sugar the most. Another self-care behavior, taking your medication. You can miss fewer opportunities, or miss fewer doses, take medications as prescribed, or increase medication, taking it on time. What I have found is I've done some research and gone through some things, and I quickly just jumped online because I couldn't find the slides that I had prior, but 30 to 50% of people fail to take medications as prescribed, and 45% intentionally miss doses. Well, if your body has gotten to the point where it cannot manage blood sugar on its own, using its own insulin and everything else that we could have a whole nother presentation on, if your body can't do that, then sometimes your body needs some medication to help. And I tell everybody, we got to be thankful for those medications that can help manage blood sugar when our body just won't do it on its own anymore. And yet we find that possibly up to almost half the people either are missing, not taking them as prescribed, or intentionally missing doses. And what was interesting when they actually did the research and questioned the people, the cost wasn't an issue. That's almost always the first thing we go to. Well, they're so expensive. And I get that. That is true, I believe, here in the United States. This research that was done in a place where all medication was paid for. So they didn't have the option. I mean, there was no reason. Cost was not truly an issue. Most people, though, in this specific research just agreed or believed the medicine didn't help that they were on. They had difficult swallowing pills, and that can be true. And they felt better, so they didn't think they needed the medicine. I mean, so with all those things, if you have questions on your medication, you should come and talk to your doctor. Don't put that off. And since I will agree that maybe for that research, cost didn't matter. I believe here in the United States, cost does matter sometimes to individuals when it comes to taking their medicine. Here at Valley Professionals, part of your healthcare team, part of what you have in your toolbox to help you manage your blood sugar, manage diabetes, are our community health workers. When it comes to the cost of medication, a lot of times when we hear that from a patient, we send, we contact our community health workers here at Valley Professionals for help. We ask them, what can we do? What's out there? What options are available? And then, the care coordinators or me as a certified diabetic educator, we work with our providers to say, hey, this medication is not affordable, but what about this medication that's in the same group of medications? So we do that a lot. Like, sometimes insurance prefers a different medication over one other, but it's the same medication. It's just, for some reason, insurance prefers it over the other in the same group of meds. So, but our community health workers are great. They help anybody in the community when it comes to insurance, but also as we use them a lot, like we need help finding affordable medicine for our patients. And that's when we go to our community health workers. And then Valley Professionals has a care coordinator at every site. The care coordinators are registered nurses, and they work closely with our doctors and nurse practitioners, again, for education. If you want more education on the medications that you're taking and you don't think they work, you don't think they're helping, or you don't like them because you can't swallow the pills, anything that's bothering you with your medication, get an appointment with one of our care coordinators and let's figure out what's going on so we can make the changes that would make you more likely to want to take your medication. And then I'm a certified diabetic educator, and I travel to all of our clinics at Valley Professionals, so I can definitely be the one to meet with you also. And then, of course, I can tell you our providers, whether it's a nurse practitioner or a doctor here at Valley, if you're not wanting to take your medication, they want to hear from you. They want to know why, so they can work with you so that we can figure out what's going on. And if this is something that's needed for the best care, of course, that's what they're here for, is to take care of you the best they can, and they want to work with you on that. So we all, our community health workers, our care coordinators, our healthcare providers, and me, we're all part of that. We're in that toolkit of yours that you can call on at any time for help here at Valley Professionals. So please use us. One of the other self-care behaviors of those 7 that we try to always hit on is problem solving. I don't know that I can't remember if we really hit on this a whole lot, but it is one that I'm going to try to do more on this year. And it's really just identifying any potential problems that might occur, plan on, situation treatments, and prevent problems by situations by kind of thinking ahead. Another one of the self-care behaviors is healthy coping. This one I know that I really do believe I have not worked on this one enough. So this is one of my goals for this year. But coping with the diagnosis of diabetes, adapting the lifestyle changes to your life when you have the diagnosis of diabetes, and then getting support from family, friends, from care coordinators, the diabetic educator, are all important when it comes to healthy coping. And one of the things I'm just going to pull one thing out, because there's a whole lot we could talk about, but we're not going to try and cover it all. We're thinking of all those small steps you can take to make a change this year in your diabetes care and self-management. So underneath healthy coping, I want to kind of focus in on diabetes distress. Living with diabetes can be tough. There can be problems and hassles that can vary in severity. I mean, you can be without your insulin, and it can be pretty severe, that's pretty important. Or it can just be you're out of strips to check your blood sugar, which is important. But if you're on one oral medication for diabetes and you don't check your blood sugar, 3 or 4 times a day, that's not the end of the world. That's not as severe. So the problems can range to very severe to, okay, let's get that done. We need it, but it's not as important as being without your insulin. And so we're going to start focusing more on diabetes distress with our patients. And I'm hoping to start using 2 different scales to determine kind of what degree diabetes is bothering you in your life. And those 2 scales are the diabetes distress scale and the problem areas in diabetes scale. So there's 2 different scales, and we're going to talk a little bit more about them here, give you a better idea of what they are. So these are just some examples from the diabetes distress scale. There's 17 statements, and you as a patient, you can jump online and look up diabetes distress scale, and it'll bring you to all 17 of those questions. And you rate your the severity of how these problems affect your life. So these are just a few of some of the statements. So feeling that diabetes is taking up too much of my mental and physical energy every day, you would rate that on, very, much, it's taking up a lot of time and energy, or not at all. And there's also choices in between, that are kind of like, oh, maybe middle of the road. But feeling that my doctor doesn't know enough about diabetes and diabetes care, not feeling confident in my day-to-day ability to manage diabetes, feeling angry, scared, and or depressed when I think about living with diabetes. And I hear that one a lot. A lot of people just get angry that they now have to change, their lifestyle because of diabetes. And I always try to encourage everybody that anything that is talked about with managing diabetes when it comes to diet and exercise are things we all should be doing, even if we've never been diagnosed with diabetes, heart disease, high cholesterol, or anything. We all should be eating healthy to give our body what it needs to perform for us. So, but anyway, it is true that many people feel angry or they've just been even afraid. And that's, again, what we're here for, whether it's me as a diabetic educator, our care coordinators, our providers are here for you. We want to help with this so that having diabetes doesn't overwhelm you or your life. These are just 4 of the 17 different statements. And then as you read through those, you scale them on how much they do affect your life. In the last month, I think, they don't have you do for, because some things can affect you. When you first were diagnosed with diabetes, it might have been overwhelming, and now you've gotten better at self-managing. So that's really not as much, but maybe sometimes. So it's in the last 30 days how you would rate these different 17 statements that they make, that actually how they affect your life. And then what you do with that is, if you find an area that is concerning, you come and you either talk to one of us, care coordinator or diabetic educator, or you talk to your doctor. And that would probably be the best thing, is to make an appointment with your doctor and bring those statements with you and go over them with the provider. I'm hoping in my diabetic education with my patients that I will start, that's my plan this year, is to start pulling those questions out and letting patients evaluate that. If we can kind of pinpoint where that area is that's concerning, it might be that one area that's holding you back from taking that step to better self-management. So this was the diabetes distress scale. That was one of the scales that you could look at and use kind of to evaluate. But the other one is called problem areas in diabetes scale. And this has 20 statements. And again, you rate the issues that are currently a problem for you. I think in the last 30 days, they have a list of them. I got 5 examples here. And again, you rate them from it's not a problem at all, or it's a pretty serious problem. Some of the examples from the problem areas in diabetes scale, these are just examples of the statements, they're questions, it looks like. Not having a clear and concrete goal for your diabetes care. Are you feeling discouraged with your diabetes treatment? Feeling scared when you think of living with diabetes? You're uncomfortable in social situations related to your diabetes care. For example, when people are telling you what you can and can't eat. Feelings of deprivation regarding food and meals. So these are just 5 of the 20 statements. So they're along that same lines. To me, they remind me a little bit about the diabetes distress scale, previously that we went over, but a little bit different. Again, if you do a quick internet search, you'll find both of these online and easily can print them off or just go through them online and make some notes. But if you don't have access to the internet or don't want to go that route, if you want to call here, I can send you a hard copy, not a problem. And you can look over them. Just encourage you not just to look over them and fill them out, but take them to your next doctor's appointment and go over them with your doctor or nurse practitioner. So another self-care, one of the other 7 self-care behaviors is reducing risk. Stop smoking. Some examples of that are stop smoking, get your health checkups at least every 6 months is really what everyone who has diabetes should be going to the doctor and getting a health checkup, and then perform daily health self-care activities. And again, let's just focus in on one of those. This is another area that I don't focus in on enough with my patients, because it seems like we're always talking about what to eat and monitoring and medication. But I did some research for an educational paper for all of our providers about a year ago or more, and it was about taking care of your feet. So if we go back to that previous slide, performing daily health self-care activities, one of them that the American Diabetic Association suggest for our patients, people who have diabetes, are to check your feet. And your doctors are usually checking your feet at each one of your office visits, if not every 6 months, more often possibly. And it's because diabetic foot ulcers are preventable. Up to 50% of diabetic foot ulcer cases can be prevented with appropriate education focused on teaching people with diabetes how to care for their feet. And I see it as our doctors document it in their office visit with patients. They go on to tell you, don't wear, I know Dr. Rico, the endocrinologist that I work with, he'll tell everybody, don't wear, sandals or flip-flops. Make sure you wear, shoes that can really protect your feet. He even tells everyone not to walk around the house barefoot. I mean, all those things to me are hard and difficult. Those would be the one thing that would maybe be something I would need to work on, because that would be really, that would be the one thing I wouldn't want to do, because I'm so used to wearing flip-flops or going barefoot. But these are things that if you can make those small changes, you can actually prevent any other further problems with foot ulcers. So a foot ulcer is the initial event in more than 85% of major amputations that are performed on people with diabetes. And I don't want to, there was a whole lot more information. I don't want to scare anybody. I don't want to bring anybody down. I just want to point out the importance and how one small thing, changing your footwear to something better and safer, can actually help you self-manage the risks of diabetes, the risks that come along with diabetes. Studies have shown that daily self-inspection is the single most effective way to protect feet, especially in the absence of a pain warning system. And what that means is sometimes if you've had diabetes for many years, if you have neuropathy, I've heard people before, they got a sore on their foot, they go, I don't even know it. They didn't feel it because the nerve endings are not signaling, hey, there's pain. And so they continue to wear those same shoes that cause blisters, or they continue to walk on that sore and didn't realize it, and it got worse. Again, daily checking your feet for any sores, and then not just checking them and finding them, but once you find them, make an appointment immediately to see your doctor. It doesn't necessarily maybe have to be, the next day acute appointment, but in the next, few days, you need to get in to see your doctor so that they can start care. You don't want to put that off. So something as simple, and I say simple and small steps, can be, hey, I'm going to start looking at all my shoes. I'm going to figure out which ones hurt my feet. I'm going to start paying. I'm going to get some diabetic shoes if you qualify for them, and start wearing them. Early detection of foot injuries such as blisters, redness, or swelling, or calluses, or toenail problems is necessary to prevent potential more serious problems. So again, something so that might seem small to some people can actually help out a lot in the long run. And that, again, is that one little thing that falls under the self-care behavior of reducing risks by performing a daily foot inspection. Maybe that will be the thing you want to do this next year. You want to set that as your New Year's resolution. If you ever start doubting that you can self-manage diabetes, if you doubt that you don't know how to manage self-manage diabetes, I want you to go straight back to your toolbox. Visualize a toolbox, and I have a picture here. And I just quickly listed a few things that are in everybody's toolbox who has diabetes, and there's probably a whole lot more, and more things you can add. And then you could even take some of these things and actually break them down into littler pieces, little steps. But you have so much in your toolbox, and I think of that and I can see it. I can see what Valley Professional offers, even with our care coordinators, our healthcare providers, and a diabetic educator, which is an unusual thing for a family practice to have. Take advantage of us, use us, so that we can help you self-manage diabetes and stay healthier longer. Keep in mind also, I mentioned the office CGM that's coming the middle of January. Anything we can do that can help you better self-manage and get blood sugar under control, it's going to make your life better. And that's what we enjoy doing. That's why we became nurses. We enjoy helping people be healthier. And I always think that's kind of contradictory, because, if everyone was healthy, they wouldn't need us. So then we wouldn't have a job. So I'm trying to figure out how that all works together. But seriously, that is why we're here. And we do enjoy meeting with patients and educating them and helping them, kind of like coming alongside them to support you as you make those decisions of how you want to get healthier. So use that toolbox. That's what it's there. And I suggest, if we go back to that toolbox, choose one small thing, one simple thing, make it simple to begin working on toward better self-management. And maybe that one thing will just be, I'm going to set up an appointment to meet with the care coordinator at the office where I see my healthcare provider, or you're going to make an appointment to see me, the diabetic educator. Maybe that's the step you want to take. Whatever it is, choose something and get started is what I'm encouraging you. Because like my winter coat, if you choose something small, no much how silly it seems to someone else, and no matter how many people laugh at you and say, oh, that's kind of a silly thing, it is a step towards the right direction. So a new year means a new chapter. And I hope that 2022 is an incredible part of your story, and it's a healthy part of your story.